Hello there, fellow caregiver. Any aches or pains? We're here to help decrease that risk. Welcome to our presentation on mechanical lifts and body mechanics. Our key takeaways include understanding parts of the Hoyer lift, how to use the Hoyer lift, and general body mechanics.
The Hoyer lift is a device that helps transfer patients between a bed and a chair or other similar resting places. First, we have the four wheels and the legs, which can widen and narrow to fit a chair, a bed, or any other surfaces. This is where the sling attaches to. The specific lift is the Birdie Evo, which can hold up to 463 pounds. Every brand has a different weight capacity. Make sure you check the capacity of the device before using. Now we have the control. This button narrows the legs and this button widens the legs. We have this button that lowers and heightens the sling attachments. When using the lift, make sure to lock or unlock the wheels. There are handles to move the lifts. Here is the battery pack. Make sure it's charged and check the battery level before using it. Here is the on and off button as well as the charge level. If you need further assistance, make sure to check the instructions that come with the lift that you are using.
The Hoyer lift sling. Here is a full body lift sling, one of the many different types of slings available. This is the front of the sling where the patient will lay. Now we are seeing the back of the sling where there are safety handles to help pull or push the patient comfortably. Provided on the sling is a label that is full of information. This includes washing instructions, weight limitation numbers, and also weight limitation description for the sling.
Putting on the sling. Make sure that you're not bending at the waist because this will cause back pain in the future. Both caregivers here are bending at the waist. The proper way to operate this lift is to use two people. Remember when you're placing the sling under your client to bend at the knees and not at the hips. When rolling your patient, place a hand on their shoulder and hip to provide them stability when guidance when rolling.
The Hoyer lift helps transport the client and helps the caregiver. Make sure that the environment is clean and clear. Position the Hoyer lift, then lock the wheels. And secure the sling. Make sure the client is always safe. You don't want them to hit their head on any swinging parts. Instead, take your time and secure all parts of the sling. Make sure your client is ready to be lifted, then start lifting the client with the control. Once the client has cleared the bed, carefully move the client, making sure they are comfortable. Use the sling straps to guide the client into the chair. The client's knees might swing into the Hoyer lift. Be sure to keep them safe. Widen the legs of the Hoyer lift, then position the client onto the chair. Lock the Hoyer lift, then lower the client using straps to safely place them into the chair comfortably. Make sure not to lower the Hoyer too much. Always be aware of the client. Don't rush the process. Take the time to unhook the sling and keep your client's head safe. Once your client is secure, remove the Hoyer and ask your client how they're doing. A safe client is probably a happy client.
Lastly, we'll cover general body mechanics. We're going to show a video of two people picking up an item from the floor. Can you identify what you see wrong? Correct, they both bent at the hips and used their back to pick up the items. The next clip will show two different ways to properly pick up an item from the floor. As you can see, the woman in the green scrubs bends at the knees to keep their back straight, and the woman in the green shirt and black pants knelt down on one knee and kept their back straight to pick up their item. Thanks for watching.